Call in, connect. To speak to Randi, call 561-270-3844. 561-270-3844.
All right, everybody. It is the last Tuesday, I guess I can safely say, of the Winter Free Speech TV Pledge Drive for 2024. That would be exactly where we are. And it only goes till Friday. So please call now, 877-378-8669, and support independent media that does not take any advertising dollars from Medicaid or Medicare or Medicare Advantage or any political or any commercial, nothing. And that leaves us free to talk about pharmaceuticals, big pharma, small pharma, your pharmacy, whatever you want to talk about. You can also text to 44321, the letters FSTV, and we will send you a secure link to make your donation, or visit us at freespeech.org and donate there. Thank you very much. Diane in California.
Hi, Randi.
Hey.
I'm a registered nurse, and I have worked at a VA hospital for the last 28 years of my life.
Do you get paid?
Yes, I do. I get paid very well,
Yay.
and the veterans love it. The veterans love it. If the VA is basically socialized medicine for our veterans. If
Right.
it's so bad, if it's such a bad healthcare system, why do so many of them want to stay with it? They do not opt to go out to private sector to get their care, even though they can.
Yeah.
They can. Obama put in a place where they can go in to private health care if they want, if they can't be seen by our doctors in time. But 3/4 of them prefer to stay with the VA because of the excellent health care. So if socialized medicine is so bad, why would we give it to our veterans?
Hey, listen, if socialized medicine was so bad, why would we give it to our seniors? I mean, Medicare is socialized medicine. It's a single payer. Same thing with the VA. It's a single payer. And guess what? It's the same payer for both. And people
So put that to the people out there who are saying, oh, no socialized medicine. The VA is socialized medicine, and veterans love it.
Yes, it absolutely
exists
is.
right now.
It is. It's absolutely socialized medicine. It's a single payer system. People love it once they're in it. They understand that, the doctors, the nurses, everybody's getting paid. Everybody's getting paid well. They're getting excellent care, top of the line, and they don't want to leave. Now, what's really interesting is that the seniors are being duped. They're being lied to. They're being told that Medicare Advantage, which is private health insurance, is somehow it's a supplement to their Medicare plan. It's not a supplement. It's a substitute. And that's one of the problems that happens when you're a senior.
Exactly. And Randi, I just want to tell you something. Before I started at the VA, I worked for a private company in California called FHP. It was an HMO. We would have to go out to nursing homes and issue denial letters to the people in nursing homes to say, I'm sorry, your coverage here is no longer existent. You're going to have your family come pick you up because you're not meeting medical necessity.
Oh,
they
God.
would have the nurses go out and deliver these denial letters and put our lives at risk because the families would be pissed off. Trust me.
I've seen people get very angry with nurses. I've seen it. I've seen it a lot, and it's horrible. It's ugly. That's why when she was yelling at me,
for
I
both
was like,
sides.
right? I was like, don't yell at me. I'll help you, But now I don't want to help you. So, yeah.
Well, here's another nurse giving you another side of the story.
Thank
okay?
you. I appreciate you, Diane. I really do.
Thank
you so much.
All right. Bye.
Bye. So here is Donald Trump saying that he has a concept of a plan to replace Obamacare because he says Obamacare sucks. It does not suck. That's just a lie. It's just one of many, many, many lies. So when he says that, you don't know what to believe. But here is what he told Kristen Welker.
Do you have an actual plan at this point for health care?
Yes, we have concepts of a plan that would be better.
Still just concepts? Do you have a fully developed plan?
Let me explain. We have the biggest healthcare companies looking at it. We have doctors. We're always looking because Obamacare stinks.
No, it doesn't.
It's lousy. There are better answers.
In your concepts of a plan, sir, will people with pre-existing conditions still have coverage And can you guarantee their prices will not go up?
The answer is yes. They'll have coverage. You have to have it.
And what about their prices?
Because you know what?
What about their prices, sir?
I want the prices to go down.
Like you promised to end birthright citizenship.
Yeah.
Okay, that's the next section. Okay, so he's sitting there saying he has a concept of, because big insurance and doctors are always looking. I don't know what the hell that meant. There was no follow-up as far as what do you mean. The idea that he said that you gotta have it, you have to have coverage. I will tell you last time what was floated as being a replace, and some of the things he did do. Okay, some of the things he did do were so bad, it was so devastating. He did things like, when the exchanges first came into being, in order to be on the exchange, meaning part of Obamacare as it was known and still is in some quarters known, you could not, A, deny somebody with a pre-existing condition. B, you couldn't raise the price of the premium based on a person's health status, whether or not they had survived a cancer or were in continuing need of health care. You couldn't increase the price on them. You couldn't offer these temporary plans that are in effect until somebody gets sick and then they dump you. And you couldn't, and so what Trump did as a big favor to fly-by-night healthcare companies was allow them back into the marketplace. He allowed these temporary healthcare companies, these short-term plans, to come back into existence. People bought them. They were dirt cheap, and they thought they had healthcare coverage. And they found out the hard way when they needed the coverage that they didn't have it. Something tells me that he's going down that road again. Either that or he is going to be the hero of all heroes. He's going to be the most benevolent dictator of all the dictators. And he is going to say, this healthcare system that we have is so fragmented. There are so many tubes through which people funnel payments to this one and that. This one pays the lab, and this one pays the imaging center, and this one pays the doctor, and this one pays the specialist. And this tube over here, you have multiple payers for both private and government health insurance services. Maybe finally, after all, he wants to solve the problem. I don't know. The only problem, he's never solved the problem we had, especially not anything to do with health. 1 million of us died because he said there was no reason to sweat the pandemic, right? He said it would all end when it got warm. He said it would all go away with the heat. He said you could drink bleach. He said ivermectin was effective. He said hydroxychloroquine. Try it. What do you got to lose? He said these things. So he froze in the face of a real health, problem, a super problem. He couldn't deal with it. Even though Obama has since told the story about how he left a complete pandemic response plan for the Trump administration to follow should we ever get to it, whatever. But maybe after living through COVID, I don't know, maybe he wants to solve it. Although, hard to believe. Don't have time to listen to the live show? Want to hear more on your schedule? Go to RandiRhodes.com and buy a stinking podcast.